Medical Laboratory Sciences, Healing Without Borders. Hello everyone, I'm your host Dalvinder Kaur from lovely Professional University. Get ready to dive into today's topic, that is Medical Laboratory Sciences as a profession in India and abroad. Before we proceed further, allow me to introduce the experts of the day. Dr. Naresh Kumar, Associate Professor, School of Allied Medical Sciences, LPU. Drawing from his extensive experience in both academia and industry, he will unveil the crucial role of laboratory sciences in modern healthcare. From cutting-edge research to practical insights, discover the latest advancements shaping healthcare globally. So I would like to introduce the admission nominee also in this webinar, Mr. Pankaj Vij, Head Department of TIEPS, Division of Admission, LPU. He is having 18 years of experience in multiple domains, including teaching, training, and operations. He is taking up the eligibility, scholarship, fee structure, and infrastructure part of the university. Before we proceed further, in today's session, I would like to request everyone for any questions, you can write in the chat box or in the Q&A box, and same will be addressed from my side in the end of this webinar. So now I hand over the things to Dr. Naresh Kumar, and it would be an absolute delight to listen from him. Over to you, sir. Sir, unmute कर लीजिए. Yes.
Yeah. Thank you, ma'am. Thank you so much.
Yes, perfect.
Is it visible? Just confirm it.
Yes, you can continue. Screen is visible.
Hello, ma'am.
Yes, sir.
Is it fine?
Yes, sir.
Okay. Thank you so much. Thank you for introduction. So today I'm going to talk about that. What is the career opportunities here in India and abroad? So medical laboratory profession in India and abroad. Myself, Dr. Naresh Kumar, as introduced. So what actually the medical laboratory sciences? It is a kind of the field which are help in a diagnosis. And what is the diagnosis? Diagnosis is a kind of, that the technique through which we are able to detect the type of disease. Okay, whatever the disease the person have, how it can be diagnosed, because if any person who's getting ill, who having the some problem, any kind of the disorder in a body, how it can be revealed, how it can be diagnosed, only through the some laboratory test. There are the series of the tests, thousands of the tests today is done in a whole healthcare industry, and only through the test it can be known that what is the problem with the patient. So medical laboratory or the clinical laboratory is the laboratory where the tests are carried out on a clinical specimen of a patient. Clinical specimen is what? Whatever the body fluids like a sputum, okay, or the pus, or the discharge from any part of the body, or the blood, or the stool, or the urine, whatever the things are coming out of our body, or the tissues, whatever we want to know, the person having some disease, it can be revealed through the diagnostic test. These are the simply technique through which we are able to detect that what kind of the problem the person has. For instance, if I say, if somebody having the kidney disorder, so doctors are going to write urea and creatinine. Through that, they are able to know the kidney is properly functioning or not functioning. So this is what the clinical laboratory scientists or the medical laboratory professional do. And here the medical laboratories are very in a size. As you know that it's a complex one and it's a variety. There are the at a district level, central level, national level, international level. There are the different kind of the laboratories are set up. More comprehensive services can be found in acute care hospital and the medical centers where the 70% of the clinical sample decisions are based on laboratory testing. What is the meaning of it? It means the diagnosis, until the diagnosis is not done, the treatment cannot be given. And whatever the treatment given now, it is simply the guess. They do not know that what is the disease and what the treatment to be. But when the doctors are writing and they get the proper diagnosis, the treatment is also given in the right way. So the patient healed within the next 2-3 days, depend upon the particular disease. So commercial medical laboratories operate an independent business and provide the testing that otherwise provided other settings due to the low cost, volume, and complexity. Now, if you are going in a small laboratories, we have the limited test. Big laboratories, we have the different tests. We have the primary health care, tertiary care hospital, secondary care hospital. So different laboratories are set up in that. Here, if I just talk about that, what is the discipline says, and the discipline is experiencing a fast growth. Reason behind, because if you just compare the previous 20 years and now there are the huge diseases are coming every day. Newer diseases are coming every day. So it is very difficult to diagnose. Recently, the COVID has gone. So the immediately the vaccine even and the diagnostic kit was also prepared. So sometimes the new diseases are coming. They are working. The industry is working to make a kit to know the test that what is the problem with the patient. So at the commitment to the challenges of the 21st century in the highly competitive environment, what to do? As you know that there is a lot of laboratories are coming up, disease is also coming up, and what to do? There's no enough doctor, no clinical laboratories enough setup. There are the almost 5,000 laboratories, pathologists, but the pathologists are very less. Technical staff is too less. So it is estimated that by 2025 there would be a 24% increase in a demand of the medical laboratory professionals. This is what I'm talking about in India. I didn't talk about the outside. In outside, it is more because they are the ratio of the patient as well as the laboratory and the doctors and the nurses. Their ratios are different as compared to the India. And if you just think about that, what is the career opportunities? So these are the people who does the medical laboratory sciences, BSc or diploma in a medical lab sciences, and after that, what they can do, what would be their designation in India and abroad. They can become a clinical biochemist. They can do even diploma, bachelor, and the master and the PhD. So that totally the designation would depend upon how much is the higher education. So the person who start with a career with after medical laboratory sciences, they can become a biochemist, they can become the microbiologist after post graduation, and after the degree and the diploma, they can become the laboratory scientific assistant. And in a foreign countries, they have some designation which is known as the biomedical scientist in the UK, medical laboratory scientific officer in a US, Canada, and Australia. So many students who has done this course, they are now working in different countries. And a medical laboratory technician, clinical laboratory technician, these are in the US also. Medical laboratory scientist assistant, phlebotomist. Phlebotomists are the person who simply collect the blood and sending to the reference laboratory. Some people having only the job to collect the blood, but again after the BSc or the diploma degree. And histotechnology, if you just talk about that, what is the histotechnology? This is again the part of medical laboratory sciences where the people are taking the tissue, sending to the lab, and they know that what is whether this tissue or the person having the malignancy. Malignancy means they have the cancer or not. It is only detected through the histopathology. So that is the one, the histotechnician work in a laboratory where they are doing the diagnosis on the tissues, solid tissues, like a skin, like a liver, like a breast, like a biopsies they are sending, and through that they are processing and they are knowing that what is the problem with the patient. Tumor, this is diagnosis in histopathology. Scientific officer, they do all the work. Medical technologies. So these are the few example I've given. And somebody, if they don't want to do the work in a laboratory after bachelor degree or the master, they can work as an application manager. Application manager means the person how to operate the machine. As you know that there is a lot of automation happen. Earlier there was a manual system, but nowadays there's a lot of automation happen, that everything on a machinery because of the increased number of the patients. So that's why, to know the fast report, the people now they are procuring the automated system. So now they need the training over it. So application manager who trained the laboratory professionals who are working in a lab. So if you are totally trained in the as an application manager, or you can be trained as an application manager, you can give the training to the laboratory professionals who are working in the laboratories, sales and the executives, and a biomedical instrumentation and the reagents. So whatever the reagents we need, hormonal assay, whatever the test we are doing, so for that how to make it, and once it is made, how it to be sale to the, how we have to do the sale of that, marketing of that to the laboratory so that they can procure it. So there's a lot of opportunity, multiple opportunities in a medical laboratory sciences, and these opportunities would remain the same here in India and abroad also. If you just think the data, the clinical laboratories are the supplies by the other multinational companies which focus on a material and the equipment. So in India, if I say, there are the multinational companies who are providing. In India, still we need a lot, like Thermo Fisher Scientific, multinational companies who are providing the so many instruments, so many reagents and software, everything they are providing. There's a $47 billion, including the consumable software and services. So other people also can work into it. So in a general laboratory, equipment includes the lab centrifuge, transfusion solution, water purification system, extraction technique. These are the few instrument on which the people have to work, the laboratory professionals. Now their requirement means they need a consumable, they need a software, they need a services also, so that all the people can do. Even after doing not only the laboratory process they have to go, they can work on all different sector of the laboratory. Another thing, in a vitro diagnosis, IVD market is approximately $61 billion. Now we have the several known companies of the medical lab sciences: Roche Diagnosis, Abbott Diagnostics, Siemens Healthcare, Johnson and Johnson, Beckman Coulter, Molecular Diagnostic. What is the role of this one? All the blood transfusion. Sometimes the students are coming; they are giving the blood also. So from how this bag is prepared, and what is the length of this, and how many days we can procure, how many days we can preserve into this one, all these things are supplied by the some companies. So these bags which we are taking, using it, and the people, your laboratory professionals, are working in these companies to make the product. So these are, if you just see about this one, this is the automation. Because of the lot of HIV, HBsAg on SCV, or so many infectious material. Now there's the automations have there in our laboratories. So simply that we have to extract the samples, put into all these machines, and automatically it's giving the result to the person. So very fast result we can get into it. Reason behind, because the every day so many samples are coming. Earlier there was a 5, 6, 10, 11, 100, but nowadays there's a more than 1500, 2000 samples per day. So that's why the automations is required. If you just see this complicated machine, which has the all kind of the disorder related to the blood disorder. Everybody may be knowing that when somebody having hemoglobin low, TLC, or the infection. So this machine is a totally closed system. Simply we have to take the samples, put into the machine, and within a 120 second, the name has given Edvia 120. Within a 120 second is going to give the almost 100 parameters. Just imagine that what is the application of this. So the people who are working in this laboratory, they are as a laboratory scientific officer in India and abroad also. Here is the automation system of the staining. What is the staining? Basically, when we just check the morphology of the cells of our body, we sometimes require a lot of time. It's consuming a lot. But now if you just make 100 kind of smears and we can put into the machine, it's within a 15 minutes, it can do the staining of that, and examination can be done fast. Here are the few machine automated identification of the bacteria. Some people may be knowing about the microbiology. Microbiology is that field where the disease is causing throat infection, but we do not what bacteria. So what we do, we take the samples, putting all these in machines. It's going to identify the bacteria. And this identification is done by automation through the coloring system. These are the cassettes through which we are able to know that whether it's negative and the positive. We identify the bacteria, and then the medicine is also tested into it, that what particular medicines. For instance, if somebody having the infection, we are just taking the swab, checking in a laboratory, whatever the bacteria we find. After that, we do the testing of the medicine also, antibiotic also. And whatever the antibiotic would be sensitive. Sensitive means which can kill that bacteria. That medicine we are writing, this writing or report is going to the doctor. Doctor is only giving that report which is in a laboratory tested already. So that medicine once given, the patient can be easily healed. So I can say almost the 99% work of the laboratory professional in a healing of the patient. If the wrong report happen here, the diagnosis would be wrong, test and treatment would also be wrong. This is, if you know that this is how the laboratory professionals, after doing bachelor degree in a medical lab sciences, they can work in a blood banking. If you just see, this is the one machine. Here the blood bags, they are the donor. Earlier, what we are doing, that we are collecting the whole blood, 350 ml from the donor. But sometime now, if I don't require the whole blood, which containing the three major components and the plasma. But suppose today's technology, if we want only the one single cell, platelet like, in a dengue, what happens there, the platelet cells decrease. And for the dengue patient, if we need only the platelet, so this is the one machine which is known as the cytopheresis. Through this machine, We can take the platelet, rest of the blood would go into another donor's body. So this is the one very updated kind of the instrument through which we can get whatever the components we want out of the body. So now this is called the cytoapheresis. Here is the molecular biology, molecular diagnosis. You know that nowadays very, very complicated. Which particular virus is coming? Now H1N1 is also coming. Bird flu is also coming. But what is the type of that bird flu? What is the corona is still going? So whatever the other viral diseases are going on, so this is the one that through automations, through the RT-PCR, through the PCR, we are able to know that. And what is the DNA damage happen? All things we can know through this complicated machine, which is known as the RT-PCR and the PCR. Here, the diagnostic sector is approximately 675 billion. Just imagine, this is the one business in INR, and it's every year it's almost growing more than 17%, 8 to 10% approximately, and in the next 5 years again it's going to be grow. Now, the diagnostic segment is a critical component of the healthcare sector globally. 80% of the physician diagnose are result of the laboratory test. Whatever their diagnosis, only just because of the test. Test done right, diagnosis right, treatment is right. So, until unless the test is not done in a right manner, so total treatment would be wrong. So, the diagnostic person who shows the path to the physician to give the type of medicine, which kind of the medicine to be prescribed. So there are the three main types of the test. Routine test, which is commonly like sugar, cholesterol, HIV, pap smear. Pap smear done to know the female cancer. And there's a clinical test, monitor the disease and drug treatment. Now, the test not only to diagnose. Suppose somebody has some disorder like a breast cancer. The doctors are giving the chemotherapy to treat the breast cancer. Now, breast cancer is working, the drugs is working fine or not. The breast cancer healed or not, healing or not. This is again to know the test. Through again, we have to do the test. Same, somebody having the throat infection, after giving that medicine, now the treatment, the patient should be fine, but still not happening. So again, we can do the test. It means the drugs is not working. So sometimes this is happen. This test is not only done to diagnose, it is done to know the exact situation of the patient after the treatment. So prognostic value as well as the diagnostic. Diagnostic means to know the disease, prognostic to know the progress after the treatment. So clinical lab tests are monitor disease and the drug treatment. That's why this is called. And especially the test like genetics, immunology where the blood bank related we are dealing, or the immune system, whether your immune is weak or strong. Immunology that deals with that. Oncology is the department which deals with the cancer type of the patients in the diagnosis as well as the treatment. Endocrinology, all the hormones which is released, and that they are like the people having the hypothyroidism, mostly in a Punjab, and the some another state, TSH, thyroid, T3, T4, FSH, which causes the infertility among the person. So through these tests, we are able to know that what is the endocrine disorder. Now, in the diabetes is also endocrine because the insulin is not forming properly. Another, we have the critical segments we know through the all the diagnostic tests. So we just look here the one overview that these are the students who are working in a laboratory. Okay, they have the different kind of the instruments, very sophisticated instrument, and they are working throughout the day and the night. So working on the laboratory to know the patient's condition and their diagnosis. So we just look here that what is the placement, after completing this degree. So what is going to be happen? So here we have given us some example also. A master's clinical microbiology, biochemistry, the people who do. In a bachelor also, people are going in a government sector. Okay, Civil Hospital of Punjab, Baba Atomic Liver and Biliary, that is the institutes of the research. The people after bachelor, Max Healthcare. Then we have the several other hospital, PIMS Hospital, DMC, CMC. So in a Punjab, if I would say that their people are working over there, they are doing the training also, and followed by the placement. So placement is already there because the student who does the work over there, they get placed also. So if I just see the overall opportunity, it's not a single opportunity. after doing the bachelor degree in a medical laboratory scientific officers as a medical lab scientist. They can become the biomedical scientist. They can work in a hospital and in the industry who make the instrument, industry who makes the kits to know the disease, clinical research and the management. So what are the research? Because if there is a failure in a diagnosis, what kind of the new techniques we have to develop? Who has to give this feedback? Only the laboratory professionals who are working. If they are failed to diagnose, they are sending this information to the research laboratories. They are working over it and finally get the reply of that, or they get the solution of it. The development of the diagnostic kit totally depend upon the laboratory professional feedback, compliance control, quality control, whether the laboratory is reporting. Sometime you might have seen that in a different laboratory we are going to different tests are coming up. Why it is coming up different tests in a different lab of a same patient? Reason behind, they are not running the control, they are not following the quality control system. So in a national or international level, we follow the quality control system and the assurance through which we are able to know that our laboratory results are 100% dependable. It doesn't mean that it's not dependable. If we are running the control, we are running the control samples, through that we are able to know process, product how to make, the kits how to make, pharmaceutical companies how to make. Now sometime what is happening, the blood which we are using, sometime it's going to be expired, but from there, before expiry, we are extracting from the blood plasma we are taking, and from that we are making the coagulation, means some factors which are in our body. We have the 13 factors which are stopping the blood. Sometimes the person may have the bleeding, so we can make this product out of the whole blood. Whole blood means we are donating the blood. Out of that blood we can make the product which can stop the blood if somebody having the bleeding. So that product can be made from the blood collected for the blood banking. Once it is near to expiry, it can be used for the pharmaceutical purpose. So there is a lot of opportunities after doing this one. Research, intellectual property. So you can't say that single opportunity only the open the laboratory. In a teaching also, industry also, in industry, different sectors also. Entrepreneurship, you know what is the entrepreneurship? Entrepreneurship is the kind of the person can start their own work. For instance, if you say that in India that there's a lot of unemployment is increasing, but I don't think so in a medical line, because medical line is a slow and the progressive, but here the opportunity is all the time. But if somebody are not interested, or they don't want to go in any industry, they can start their own work also. Entrepreneurship they can start. So here the DMLT, after doing that, they can open their laboratory. BSc MLT also, clinical microbiology, clinical biochemistry, and the clinical embryology, now the another course which do the IVF system, right? But these are the master degree. They can start their own center also, they can start their own laboratory also after completing their master. But after bachelor and DMLT, you can start your own laboratory with a limited number of the test. So here the higher education, if the person now they have done the DMLT, want to go for the BSc MLT, they can go in a lateral, or they can start their own lab, or they can do the further qualification into it, PhD even, master even, clinical embryology, clinical biochemistry, masters in clinical micro, histopathology, which we are not offering, however, but histopathology, right, and immunology. There are several other of a medical courses they can go with it, and a PhD in a clinical services or clinical all laboratory sciences, they can go for the PhD. Means starting from diploma to the higher degree, they can do their professional work. And yes, of course, our students who are even working on a pneumococci. Pneumococci is, pneumonia, everybody may be knowing. Our one students, he is working in a WHO and making the vaccine over the pneumococci. So how it is in a good things for the our alumni that who is working in a WHO in a vaccine preparation. They have done bachelor degree, after that the PhD. BSc, master, and the PhD they have done, and now they're working. Now, sometime the people having the one question: can after the master or the bachelor degree, can we do the signature over the report, or are we eligible to do the signature? So, frankly, here the few which are the test number of the tests they have given, they have already prescribed that on what report you can do the signature, urea, creatinine, electron, almost 1,000 tests that you can do the signature and give to the patients. And here is the means the heads of the department must process recognized basic university medical degree qualification equivalent degree. It means sometimes the people who are doing the masters in a clinical and then finally the PhD in a clinical microbiology, so they can become even the professor in a medical colleges also. If you just look over here at a red I mentioned here, can they go for the teaching in a medical college also? So I would say yes, they can go in a medical college also. So here the registration of all the laboratory professionals after doing. This is the one bill who has introduced in the Lok Sabha and the Rajya Sabha, and now it has been passed. Okay, so there is a process is going on in so many states. Now slowly and slowly it's coming in a Punjab also, but in so many states is already in effect. After completing your degree from the UGC, like from you are doing, wherever you are doing, you need to register with this council, and then finally you can get the job in a healthcare sector, in a hospital, or in a railway, or in an army, or wherever you want to do. So this is the one healthcare professional bill has been made, and now it's in effect. So what actually the medical laboratory and the life sciences, this all, if you just look over here, medical laboratory science professions, cytotechnicians, forensic science, histotechnologists, hematotechnologists, medical lab technologists, clinical scientists, cell genetics, and the molecular. These are the person who is in this one. This is the what I'm showing. It's not my own. It's a Gazette of India. So from there, I have just taken this. What are the title they have given for the job? So government now allows the clinical scientists to do the signature for lab test. So here the few, the government, All India Medical Sciences, who is allowed to perform. Earlier, the people having the one question after bachelor degree or the master, can we open our own laboratory? So here is the one letter of the government that they are giving permission. Yes, of course, you can start it. So our major placement companies, Lifestyle Recruiters, Pathcare, Whole Life, Decathlon, Cactus, so Lalpath, and other imaging services. So these are the people, these are the companies where our students are working in a marketing field, especially because they are the once they are joining as a freshers, they have the good kind of the package also. So that's why. And otherwise, the 40s, quants, thyrocare, these are the people who are working over there as a laboratory managers also, and laboratory professionals also, and some are the coordinators. So here the Siemens industry, what I've just talked about, that the Siemens who is making the instrument of the lab. So Ankit, who is working as the area manager, he is from the Punjab and he has become a manager, area manager. So now there's a lakhs of the business every day. And so they are selling in companies, they are selling the instruments and earning a lot. So Fisher and the Paykel are students who are working as a regional sales manager, territory manager, area manager. So just telling you that overseas is also. Feroz Ganai, which I'm talking about, this is the one student who is working a postdoctoral fellowship WHO and who is working over the pneumococcus, Rupinder, microbiologist in a USA, Canada, so Kabul University. So the students who are coming and medical laboratory sciences from the different countries, they are working over here, they are learning, and finally they are going abroad. Even the students from the Punjab or from anywhere who is working over here, who has done the degree from here, they are working in a different countries. So if you just we don't have that much of the time to show every single student, but these are the our gem students who are these. This is the one, and now who has worked a lot of during the COVID, Dr. Remy Kaur. She has done the bachelor degree, later on masters and the PhD now, and she is working as a government sector field, as a microbiologist, right? So these all the people who are working everywhere. Some people are doing the entrepreneur. He is there is this person, right? This and these are all just Joe, who is working in a USA. He has done the master clinical. So post bachelor, you have even the good opportunities also to go for the higher education. But if you want to start your career, start with your job even after diploma, and even bachelor, you can start it. So if somebody want to go outside, especially in a UK, just I give the one example. All the countries example I can't give, but you just see over here. These are the so many biomedical scientists. Though these are the jobs they can fill, right? And paramedic also, orthopedic also. So now these are the people. This type of jobs are basically published in a National Health Services UK. So this kind of the jobs recently, we have taken this one from website of the Health Professional Council UK. So these are the people who are working. Thank you so much. If you have any question, you can ask. So this is the ones that what is the opportunities in India and abroad. So if you have any question, you can ask.
Thank you so much, Dr. Naresh. So it was a wonderful delight for discuss on automated identification by the diagnostic segment regarding placements done in 2023, career opportunities in this particular program. You can open up the on clinic or lab setup and many more from Dr. Naresh Kumar. We'll take the questions later. So now I would request to the admission nominee, Mr. Pankaj Vij, to be on the screen. Over to you, sir.
Right. Thank you very much. And thank you, Dr. Naresh, for giving a beautiful insight into the world of medical lab technology. And
Thank you, sir.
what I've learned or what I've inferred out of your talk is that a medical lab technician or a medical lab scientist is as important as a doctor. So
Yes, exactly.
your field of study shows a path to the doctor for making the further diagnosis. So it's a great field, especially for medical students, even for non-medical students, doesn't matter. So for science students, it's a great field. Now, let me just tell the students who are watching this particular broadcast that we at LP are offering this particular program. And well, I'll tell you about the fee structures and the scholarships and everything, but I'll also tell you about the university as such, things like infrastructure and so on and so forth. So let's get started. The first thing, the most important thing is that any university should have the proper accreditations and approvals to its credit. And we also have the different approvals and accreditations to our credit. Let me show you some of the approvals that we have got. We are a NAC A++ university having a having a score of 3.68 out of a score of 4-point scale. So we are NAC A++, which is the prestigious ranking by the government of India. We also have approvals from some other accreditation councils, and that is Accreditation Council for Business Schools and Programs. This is for the business programs. We have got approvals from the Indian Council for Agriculture Research. This is for the agriculture programs. We do have a approval from UGC, both for regular and for distance programs. We have got approval for B.Ed, M.Ed courses. That is the education courses under National Council for Teacher Education. Now we have got approval from Pharmacy Council of India. We have got approval from Council of Architecture. So this list goes on and on and on. So we've got all the necessary approvals. The university has all the necessary approvals which are bound to be there with the university, and we have got them. We are even membership. We have got the membership for prestigious institutions such as AICTE, All India Council for Technical Education, and Association of Indian Universities, and so on and so forth. Talking about placements, Dr. Naresh explained about the placements in his specific field. I'm just going to give you an overview of the highest packages that the university students have taken. What you're seeing on your screen is a fantastic package of 3 crore rupees backed by this student. And there are multiple other students which have bagged multiple lakhs worth of a package in industry giants and across the world, across the globe. And this is the 1 crore club that we have got over here. So placements, we try to get our students placed in different organizations of repute, and they make it to the best places across the world, in India, of course. Talking about extracurricular activities, which is once again an integral part of education. So extracurricular activities, what's the kind of extracurricular activities and exposures that we give to our students? It is as follows. Quite recently, the concluded Khelo India University Games, we were ranked second, or we bagged the second position in India amongst this Khelo India University Games. And the likes of Neeraj Chopra, the likes of Bajrang Punia, the likes of Manpreet Singh, the former captain of the Indian hockey team, which brought the bronze medal in the Tokyo Olympics. So they are all our students. So you can imagine the kind of exposure we give to our students if they are interested in extracurricular activities, sports, culture, and so on. The year was 2019, and we hosted the 106th edition of the Indian Science Congress, and it was inaugurated by none other than the Prime Minister of India, Shri Narendra Modi ji. And he's been to the campus and he has inaugurated this Indian Science Congress. That was in 2019. Yet another year, we had His Holiness the Dalai Lama, who came to the campus and gave away degrees in a convocation ceremony. Similarly, we had two former presidents of India and Afghanistan, Shri Pranab Mukherjee and Shri Hamid Karzai, who came to the university campus and gave away degrees in yet another convocation ceremony. And we had Shri Arun Jaitley ji, the late Finance Minister of India, who came to the campus a few years back and inaugurated a startup school. In 2018, we had the then Vice President of India, Shri Venkaiah Naidu ji, who came to the university campus and gave away degrees in yet another convocation ceremony. We also invite spiritual intellects like Gohar Gopal Das, who give sermons to students, to teachers, to parents, and the philosophical part of spirituality. Yes, these people also throng the campus. They also come to the campus, the real heroes who are the real life heroes of our young generation. They come here to sing and dance, but not only to sing and dance, but also to interact with our students and share the life experiences with them. Infrastructure, well, another vertical of good education is the infrastructure. These are the kind of blocks that we have got in the university. That's a marvel of a building, 14 blocks joined back to back. And it houses the central library of the university. It also has in the front of the building, you're seeing an open air theater where students perform nukkad nataks and other things. That's the auditorium of the university. It has a capacity of 2,500 people in a single go. These are the kind of labs that we have got. This is the computer lab that we have that you're seeing on the screen. And similarly, we have got labs for all the departments which require labs. That's the library. That's the central library of the university. Every department has its own library, but there's a central library as well. Well, it's a 600-acre campus that we have got. It's a 600-acre campus, and it's located at National Highway number 44, and which runs from Amritsar to Delhi. And at the heart of the campus, heart of the 600-acre campus, we have got a mall. And let's go inside the mall. I'll take you inside the mall. Well, that's the interiors of the mall. The interiors of the mall has Providence stores where students can purchase their stuff. They can buy their stuff. They can shop from there. It's got gymnasiums with trainers of repute. It's got recreational facilities such as bowling alleys and so on. God forbid any student falls ill, but if a student falls ill, we are ready with a hospital within the university. It's a 25-bed hospital that we have got with resident doctors, medical staff, sports staff, and even a dental chair. There's a dentist who visits the university twice a week and for the dental needs of the students. So we are ready with the primary health cares of the student. We even have ambulances which can pick and drop the students from the hostels to the hospital. Well, that's the open air theater that we have got for all the open air or for all the activities in open. We have got this open air theater where the cultural events and things like that can happen. That's a panoramic view of the university. It's a very lush green and a clean university. A few years back, we were awarded as the cleanest university in India, one of the cleanest universities in India by the government of India. And that's a night vision of the university. And let me show you the infrastructure for sports that we have got. We are creating sports leaders because we have got, we can boast great infrastructure of sports. What you're seeing on your screen is an all-weather swimming pool. We have got Olympic-sized swimming pools. We have got shooting ranges. We have got courts of any proportion. You name a court, you get it. Basketball, badminton, volleyball, even a squash court is there in the university. So that's the aerial view of the indoor sports complex that we have got within the university. The hostel facility, well, we have got students from all the states of India and around 50 countries across the world. So there are around 25,000 students who can put up in the hostel facility that we have got. Boys and girls hostels are within the 600-acre campus, but they are absolutely separate out. And the 600-acre campus is manned by a strong contingent of guards 24/7, 12 months a year. So that's the hostel facility that I was talking about, with healthy mess and food facility also available to the students. Now, let me take you live. And if a student wants to know about the eligibilities, the fee structures, and other such things, they can visit our website. And that's the website. I hope it's available on the screen. It's visible. Yes, it's visible on the screen. So this is the website, lpu.in. That's our official website. If you want to know about any program that you desire to go in for, all you need to do is log into lpu.in, go to admissions, and for all the students who want to go in for a UG undergraduate program, they need to visit this section after 12th. Anybody who wants to go in for a PG program needs to visit this link and say, we want to know something about BSc Medical Lab Technology. So after 12th, I go to regular programs. I click it over here. The page takes me to the next page. And in the next page, it will give me all the disciplines that we are offering. So that's the area of disciplines that we are offering. And this is MLT, Medical Lab Technology, Paramedical Sciences, and Embryology. So I just click it over here. This shows me BSc Medical Lab Technology. It's a 3-year program having a total of 6 semesters in it. So I just click on this thing and it takes me to the next page. I just scroll down a little bit and this shows me the eligibility of the program. The eligibility of the program is passed with 60% marks in aggregate in 12th with English, chemistry, maths, or bio. So a medical or a non-medical student, both these students can go in for the medical lab technology. So it's not only biosciences oriented program. So a non-medical or a maths background student can also go in for a program. And the student has to write a national level test, which is the LPU Nest or CUET. LPU Nest stands for Lovely Professional University National Entrance and Scholarship Test. This is our own national test. And the other one is a Common University Entrance Test. So you can appear for any one of these tests. And a student needs to have 60% marks in the 12th standard. So that's the eligibility criteria. Let's see what is the fee structure. So I just click it over here on the top slider. There's a thing called fee. So I just click on the fee and it shows me the fee of the program. The basic fee of the program is 80,000 rupees per semester, but that's the basic fee. There are a lot of scholarships being offered on it. Let's take a look on the scholarships. If a student has got 80 to 89.99% of marks in 12th standard or is in the category 3 of our LP Nest exam, there's a 30% scholarship and the fee goes down to 56,000 per semester. If I have, or if a student has 90 to 94.99 in 12th or is in the category 2 of the LP Nest exam, there's a 35% scholarship. Fee goes down to 52,000 per semester. And if a student has 95% or above in 12th standard or is in the cut-off 1 of our LP Nest exam, there's a 40% scholarship. Fee goes down to 48,000. It's worth mentioning over here, dear students and parents, that these scholarships that I've just showed to you, once a student gets these scholarships, say 30%, 35% or 40%, it will remain the same way for the next 3 years for the 6 semesters. So the fee will not get incremented. Once a scholarship has been awarded to the student, these scholarships that I've just shown you, it will remain the same way throughout the course of the program. Let's see what are the other scholarships that are available to the students. The other scholarships are marks-based. I've told LP Nest based, there's LP Nest based scholarship. We are offering scholarships on the basis of national level test, which is CUET, NEET, which is the medical exam. What are the other scholarships that are being offered? If a student has some entrepreneurship experiences or innovations, we have got scholarships for such students as well. We have got scholarships on the basis of students doing good in sports and cultural activities. Student, if he or she is a board topper, what are the other scholarships? There are certain financial aids like need-based scholarship. Student from an economically humble background can apply for it. A single girl child in a family, if there's only one kid and that's a girl, so that also becomes a need-based scholarship. Then if it's a transgender student, if it is a student, it's a single parent student, which is a single mother. So all these scholarships are embedded in need-based scholarships. Well, then talking about the defense people, defense military forces, military, paramilitary, and military forces, all the people who are working with the defense forces, the wards of the such students are facilitated with the scholarships owing to the sacrifices that the defense people make for the country. So we facilitate the defense people, and God forbid any student is an orphan student or a disabled student, such students are also in for certain scholarships. So there are loads and loads of scholarships that we are offering so that the student economics is not a criteria or is not the hindrance in somebody's education. We have got our helpline numbers mentioned over here. If a student wants to inquire about any program or wants to inquire about as such career counseling, then he or she can call us on this particular number. That's 01824-517-000, or this particular number. You can even write to us on admissions@lpu.co.in, and your queries would be answered. So I guess that's all from my side. I hope the information provided by me was useful for the students. Back to you, Dalvinder ma'am.
Thank you so much, Mr. Pankaj. Now, can I take questions from our participants, Dr. Naresh?
Yes, ma'am.
Yes, let me start with the first question. Thanks for giving me chance to address your questions. Jabika is asking here, how do advancements in medical laboratory sciences contribute to global healthcare improvements?
So basically, what is happening earlier, there was a limited test through which we are able to diagnose. But the diseases which are happening today is becoming too complicated that it cannot be detected with a single or two or three tests, series of the tests. Now we need up to the end. For instance, if you want to detect today's blood cancer in a someone, there are the blood cancer type, and this blood cancer type, if we are able to detect the particular type, the treatment would be given, the chemotherapy would be given with a particular diagnosis. If we are able to find with a particular kind of the cancer, so particular drug would be given for that. So now, because after giving the therapy, the person who is getting that, their hairs are fall, their skin eruption happen, so that is now low. So that's why. So whatever the technology is updating, it's giving the very fine kind of the diagnosis, and very fine drugs synthesis is also happening to eliminate the most of the adverse effect on a patient.
Yes, sir. Thank you. Jabika, I hope you got your answer from expert Dr. Naresh. Let me take the next question from Gurpreet. How do medical laboratory sciences support medical research and innovation worldwide?
The thing as because some diseases, like if I just take the name of nowadays a new disease are coming, sarcoidosis, which causing the lungs disease, right? And if you are going in a very small hospital, they are not able to diagnose. So what actually, please kindly repeat the question once again.
Yeah, sure. How do medical laboratory sciences support medical research and innovation worldwide?
Exactly. So what is happening? Once they found the problem, that the diagnosis is not completed. Now the doctor is stuck. What treatment we have to start? So they start managing the diabetes. For instance, they start managing the disease. One more example, the diabetes today, there's a lot of research happen, but still there is no permanent treatment of it. So diabetes can be managed, but cannot be treated. So that's why every day new researchers are coming with the some finding, and they're trying to find out the permanent solution of the diabetes. That is the one. So that's why whatever the problem coming, it is coming to the problem. Then the researchers are picking that problem and trying to working towards that. That's why.
Thank you so much, Dr. Naresh.
Clear question?
Yes, sir. Let me take the next question from Megha. My ward is confused between going for a PG nearby and a university hostel. Please help me making a choice in this. For Mr. Pankaj, yes.
PG.
Okay,
Acha,
right.
acha.
So, well, that's a query which is a very common query, and it's a very important query as well, and it's a very good question as well. I would always recommend that the students coming from other states or far and flung places, whenever they come to the university, I would also always recommend, or we always recommend, that the student should be staying in the university campus in the hostel facility that we provide to the student. The reasons are as follows. Point number one, the student stays with us. Student is absolutely secure. The student stays within the 600-acre campus that we have got, and we are completely responsible for the student, and it's a right. So it's a very secure campus, I was telling you. So the student is absolutely safe and sound. So you need not worry. So a parent staying anywhere across India need not worry that his or her ward is within the university campus and is absolutely secure. So security is the prime concern. So anybody who is admitting the student to the university should prefer the hostel facility. Point number two, mess facility. Yes, the food is not as good as the homemade food or the home cooked food, but it's healthy and it's as per the norms which have been adhered to by the university. So I would always recommend that the student should stay within the university campus so that he or she is secure and gets food and nourishment at the proper time. On the contrary, if a student stays outside in a PG or something like that, you are always worrisome that what kind of a company he'll get in contact with, and it's a new place. Punjab is a new place, or any new state. It's always a worrisome situation for the students or their parents outside. So it's always recommended to admit your student in the university campus in the hostel facility that we offer to the students.
Thank you so much, Mr. Pankaj. I hope all the participants got the answers from our experts. As we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding their admissions. If anyone want to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a nice day.
Thank you.
Okay.